dual antiplatelet therapy, that is DAPT in neurology and cardiology. So DAPT in neurology and cardiology. The first condition we discuss is TIA, that is transient ischemic attack. For transient ischemic attack, we prescribe aspirin plus clopidogrel. First we give the start dose of aspirin 160 mg to 325 mg along with clopidogrel start dose of 300 mg to 600 mg. Then we give aspirin 50 to 100 mg with clopidogrel 75 mg for 21 days. Then followed by clopidogrel 75 mg for 90 days. Here clopidogrel is given instead of aspirin because aspirin has resistance in some groups of population, but in India the aspirin resistance is not much detected in the Indian population. So why we have to give a dual antiplatelet therapy in TIA? Because in TIA there is increased risk of developing stroke in next 48 hours. In the next 48 hours, the TIA patients are prone to develop stroke. So in order to prevent the risk of stroke in TIA patients, we give the dual antiplatelet therapy according to the above protocol discussed. Okay, there is a ABCD2 score for prognosticating the TIA patients. ABCD2 score. A is age greater than 60 years, we give score of 1. B is blood pressure. If it is greater than or equal to 140 by 90 millimeters of mercury, we give score of 1. C is clinical symptoms like unilateral weakness. If present, we give score of 2. If there is speech impairment without weakness, and there is speech impairment without weakness, we give score of 1. Here D is duration of symptoms. That is, if the duration of symptoms is greater than 60 minutes, we give a score of 2. If the duration of symptom is between 10 to 59 minutes, we give score of 1. The other D here is diabetes. If present in the patient, we give a score of 1. So when the score is between 0 to 3, there is low risk of developing stroke in the next 48 hours in this TIA patient. The score is between 4 to 5, there is moderate risk. When the score is between 6 to 7, there is very high risk of developing stroke in this patient in the next 48 hours. Okay. Then the other condition here is for secondary prevention of stroke. For secondary stroke prevention, there is a trial called Charisma trial. Which is conducted on 15,000 patients for aspirin versus aspirin plus clopidogrel. So Charisma trial conducted on 15,000 patients for aspirin versus aspirin plus clopidogrel for the secondary prevention of stroke. According to this, if NIHSS score less than 3, dual antiplatelet therapy is recommended. When the score is greater than 3, we give aspirin alone, 325 mg stat dose, then followed by 75 mg of aspirin daily for lifelong. We should not continue DAPT, that is dual antiplatelet therapy, beyond 90 days. In any neurological condition, we should not continue the DAPT beyond 90 days because there is increased risk of bleeding. So we should not continue in any neurological condition beyond 90 days because the dual antiplatelet therapy has increased risk of bleeding. So the next condition is DAPT in lacunar stroke. DAPT in lacunar stroke. For lacunar stroke, we give dual antiplatelet therapy for only 5 days. Next, DAPT in intracranial large artery thrombosis. For intracranial large artery thrombosis, the DAPT is recommended for 90 days. The DAPT is recommended for 90 days. So, these are the various neurological conditions where we give the dual antiplatelet therapy. Now, let us discuss dual antiplatelet therapy in cardiology. The first scenario is patient has MI. Suppose it is a STEMI and the patient has underwent percutaneous coronary intervention. For this patient, we have to prescribe aspirin plus prasugrel or ticagrelor. Aspirin plus prasugrel or ticagrelor for 1 year duration. The other condition is MI, that is STEMI, with thrombolysis. This patient has underwent thrombolysis. For this patient, we give aspirin plus clopidogrel for 1 year duration. The third person here is the patient has NSTEMI, that is non-ST segment elevated MI, and this patient has underwent percutaneous coronary intervention, that is PCI. For this patient, we have to give aspirin plus ticagrelor or prasugrel for 1 year duration. The next patient, he also has NSTEMI, and this patient is on medical therapy. This patient is on medical management. For this patient, we give aspirin plus ticagrelor for 1 year duration. Now, the other patient, he has stable angina, and this patient has undergone PCI, percutaneous coronary intervention. For this patient, we prescribe aspirin plus clopidogrel for 6 months duration. The other patient, he has stable angina and he is well treated with medical therapy. This patient requires aspirin lifelong. So these are all the various conditions in cardiology as well as neurology where dual antiplatelet therapy is required. These are all the latest guidelines according to API update.